Раз. 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 I hope you hear me now. At least I hear myself and my device. Okay, so let's start. I guess we need to start to discuss yesterday questions. The questions, as I remember, were about tickets. Will you see tickets or not? You will see questions and you will not see tickets itself before exam. So in exam you will see tickets. Yes, and another question was about preparation time. Preparation time will be 20 minutes, and Dr. Turkina said me that you already discussed all aspects about organization of exam. So, but I can remind you, 20 minutes. For people who are offline, 20 minutes in department, and for people who are online, it will be 20 minutes with a camera which is turned on. So that's about preparation time. And if you have any other questions, you can type it in chat box. Okay, before you type in your questions, I guess maybe to share my experience about previous exams. So you have a list of 100 questions. That's not so much for final exam. And from my experience, the most problematic part for most of students, and I don't know why, but maybe because of difficult topic, most problematic is usually endodontics. So I would recommend you to focus on endodontics in your preparation, because mostly for most of students endodontic is the most difficult part. So if we see questions, yes. Oral mucosa diseases is also a difficult aspect, but it was your last semester, so I am sure you remember topics well because it was recently, but endodontics you had previous years, so maybe you can forget some aspects. In endodontics, what aspects usually cause more difficulties? Very common question is the question why in pulpitis night pain is usually worse. Pain is usually worse at night or evening. I'm sure you remember the answer, but maybe I will remind you. In pulpitis, pain is worse at the evening and night time because of activation of parasympathetic nervous system, nervus vagus, which is responsible for pain sensation. That's why pulpitis pain is worse at night. It's a very common question in exam, not only in our university, but also in Rudien, for instance, where I teach too. So how to answer this question is to say that at night activation of parasympathetic system happens, and that's why pain is worse. You will not have clinical cases, you will have only questions, so it is relatively easy to compare with having clinical cases where you need to do diagnostics and differential diagnostics. And regarding you have preparation time, 20 minutes, which is also very good conditions, because for instance previous year in Rudien students who had online exam had no time for preparation. They just could read the question fast and after that answered immediately. So you will have 20 minutes, it's quite convenient for you, so you will have time to think and maybe to clarify question if it is necessary. So that's good. Okay, any questions from you? Okay, if no questions, so while you're thinking, maybe we need to discuss endodontics more detailed, because from my experience, endodontic is the most problematic part. So let's see your questions. I have a list here. So what is there about endodontics? About endodontics. Okay, so we have what? Acute irreversible pulpitis, chronic hyperplastic, chronic irreversible. Well, I don't think it is so difficult, but let's repeat. So for the difference between acute and chronic irreversible pulpitis, it is duration of pain. So acute irreversible pulpitis, it is when inflammation in pulp just started. Yes, and so it lasted about 2 days. In chronic irreversible pulpitis, there are basically two stages, two periods, asymptomatic and symptomatic. So chronic irreversible pulpitis is characterized by so-called silent period where no symptoms, and period with symptomatic period where pain happens. So in person with chronic irreversible pulpitis, pain may appear several times, and after that it will be period without pain, period with pain, and so on. So if you ask patient about patient history, patient may tell you that pain appeared 2 days ago and patient had known this pain before. But if patient mentioned that such pain already happened, for instance, 1 month ago and disappeared after painkiller, after that about 1 month no pain, and after that exacerbation again, pain again, so you can guess that maybe it is chronic irreversible pulpitis. All pulpitis, both acute irreversible and exacerbation of chronic irreversible, characterized by quite specific pain. First, it is lingering pain to all stimulus and mostly to hot. So after hot tea, for instance, or coffee, pain will happen and will last it some long period of time, like half an hour, 1 hour, and so on. Also, pulpitis pain, it is maybe spontaneous pain without any reasons, and this spontaneous pain always will be worse at night and in evening time because of activation of parasympathetic nervous system. Also, pain with pulpitis pain may refer to other anatomical structures, for instance, in the temple area, in the ear area, and the most specific referred of pain, it is in the same tooth of opposite jaw. For instance, if it is 1/6, pain may be in 4/6. So this is very specific transmitted of pain. Yeah, the same side, but not opposite side. So transmission from 1/6 to 2/6 not possible, but from 1/6 to 4/6 possible. So patient may feel pain in 4/6, but problematic is 1/6. So this is also very specific referred pain, irradiated pain. This irradiation is typical for pulpitis. One more complicated aspect, it is percussion in pulpitis. Many students often confused if percussion painful or not. Usually no, because in pulpitis we have inflammation in pulp and we have no inflammation in periodontal ligament. And we know that painful percussion means tapping on the tooth. It is when we have inflammation around the root in periapical zone and surrounded bone. And mostly in pulpitis, no inflammation there. So percussion will not be painful. But if pulpitis is very long lasting, for instance several months without treatment, patient don't visit dentist. So for very long prolonged pulpitis, percussion may be slightly painful, sensitive or slightly painful. But it is only for cases where pulpitis is very prolonged without treatment. For regular cases, percussion is not painful. So we call it like advanced pulpitis. For advanced pulpitis, percussion may be slightly painful or sensitive. That's about pulpitis pain. And usually when we do evaluation of pain, both from patient history and from cold test and percussion, we can make conclusion about endodontic pathology. So if it is pulpitis or if it is apical periodontitis. In apical periodontitis, it is very important to do cold test to verify if tooth is vital or no. Because if we have, Okay, Arash asked a question about questions which not included in program. I don't think here, can you clarify what question do you mean? So I have the list of questions here. You can just tell me the number. What question you consider not included in program? Tell me the number. I have a list here. Oh, not tell, please type. Okay, Arash, I'm waiting. I hope you are typing questions which you consider not in the program. Yeah, I understand you. I understand you, but can you please tell what exactly, what questions? Of course, you were provided by additional information, but as far as I see, all these questions are included in program. So I read all questions yesterday. That's a regular program of all dental universities, not only our university. Mm-hmm. Yeah, I understand the rush, but yesterday we already discussed that it's requirements of our administration to use YouTube channel. So we have 45 minutes, so we have half an hour more. It's, I guess, more than enough to type questions number. You can type just numbers of questions. It's not so. I have a list here, so I can easily find it. Aha, 45, 46. Let's see. Periapical abscess without sinus. Acute apical periodontitis of pulpal origin, chronic apical periodontitis. You didn't see the treatment? Treatment for periapical abscess and apical periodontitis. Okay, it's endodontic treatment. I guess you have presentations about step back and irrigation and obturation. So for all endodontic pathology, it is endodontic treatment. It is a shaping of root canal, irrigation and obturation. I guess it is there. Yeah, in some cases it is students a bit confused, but for all endodontic pathology, endodontic treatment is a treatment. Yes, both for pulpitis and apical periodontitis, the source of infection is root canal, so we need basically to clean root canal, to irrigate it, and to obturate. I didn't really get what is mean A, B, AB. What do you mean? Okay, one moment, I just will open DL Sechenov to check, because I checked yesterday. The material we have received, I couldn't find. Okay, one moment, I will open DL Sechenov, because yesterday I checked all these questions. One moment, Arash, I'm checking the Sechenov to be sure. Yesterday I've seen the presentation. Odontics practical class. Parties. Okay, about periapical abscess. You have diagnostics, but yes, endodontic treatment, it is included shaping of root canal, irrigation, and obturation. The only difference may be that if we need to do permanent obturation or temporary obturation. Temporary obturation we usually do when we have no time, for instance, to finish endodontic treatment, or patient has no time, and we need to do one more appointment because of time, or when it is impossible to dry root canal. But these aspects I think is discussed in the presentation about temporary obturation. But yes, basically all steps are the same for all endodontic pathology. It is shaping of root canal, instrumentation, step back or crown down either, irrigation for disinfection, drying and obturation. And there are presentations dedicated to both step back and crown down, obturation technique, irrigation protocol, so you can see there. If the source of infection is root canal, we need to clean and obturate root canal. And in all endodontic problems, the source of infection is root canal. Okay, any other questions? Yeah, I understand you, Arash, I understand. Well, we have to follow. Okay, about that time, what time you mean when you've been in a 3rd year of education? But I guess presentation didn't change so much from that time. Yeah, and about presentation, I'm sorry to say. Okay, people, I can't help you with this. So my duty today is just to spend 45 minutes to you discussing examination question. So if you have any questions to our administration, go to them, okay? Lectures are quiet talk. Okay, lectures. Well, lectures, it's okay. Regular form of communicating with students in high school. Lectures, yes. For instance, in my time, we had no presentation at all. We wrote everything in our notebooks. So you have presentations, believe me, it's more convenient. Okay, do you have any questions, people, about examination questions? I mean, maybe theoretical, maybe you don't understand some pathology or histopathology. Okay, Arash, you are free to leave. Actually, that's up to your wish. Consultation, it's not a must. It's not oblique. It's up to your wish. Okay, so maybe I can find some difficult questions here to discuss as far as it's the last consultation, not to waste our time. Irrigation. Let's discuss maybe irrigation. Because from my experience, irrigation is also problematic part. About irrigation, okay, let's discuss irrigation while you are thinking about more questions. And actually, if no questions from your side, we can finish, not to waste your time, people. Okay, so I guess I want to explain irrigation, and after that, if no questions, we can leave, no problem. So for irrigation, basically we use 3 solutions. One is sodium hypochlorite, and the function is disinfection and dissolving of organic parts of pulp. Usually about this second function students forget, so don't forget that one of the function of sodium hypochlorite is dissolving of organic pulp. EDTA, it is for dissolution of smear layer, and chlorhexidine, it is for additional disinfection. And chlorhexidine mostly acts about Enterococcus faecalis, which is very aggressive microorganisms which live especially in the apical periodontal periapical lesions. So that's actually, I guess, now you need to remember about irrigation. And I don't see any difficult questions in this list, but if you want to know something else about these questions, so please ask me. Okay, I see no more questions. So how many participants do we have? 7. Okay, 7 participants. So actually, people, I don't want to waste your time. If you have no any questions about exam, maybe we can finish. Okay, so no questions. Okay, people, before we finish, I would like to say you one more thing again about endodontics. So just for me to be relaxed that I said you everything which usually problematic in exam. One more problem which often happens in exam when, for instance, in Ruden I have an exam and so on. Many students mixed calcium hydroxide for root canals and calcium hydroxide for direct pulp capping. So in exam, please don't mix these two materials. For root canal, we use suspension, the calcium hydroxide suspension, and for direct pulp capping, we use silicate cements and other calcium hydroxide cements. And there are some tricky questions like, is it possible to use the same material? No. So that's the last I want to tell you before exam. Don't mix these two materials because students often do mistakes in this very aspect. So calcium hydroxide for direct capping and for root canals is not the same. And that's, I guess, the last I want to tell you. The last I want to tell you, and maybe if no more questions, we can finish, not to waste your time. Okay, people, so let's finish. Good luck to exam, take care about virus, and goodbye.